We are in Kenya, Nakuru County, Gilgil Sub-County, Karunga location in Karunga Health Center. My name is Virginia Thongoro. I am a nurse working as a PMTCT nurse and also performing other general duties and also serving as the facility in charge Karunga Health Center. PMTCT means prevention of mother-to-child transmission of HIV. PMTCT is important here because we want to ensure that all the mothers who deliver safely. We ensure that there are no HIV infection in infants. This will help a great deal in reducing the burden of HIV in our country. We face many challenges, including reduced human resources. We have very few staffs working to serve at the facility. Sometimes we have stress in accessing the areas where our clients live due to poor roads infrastructure. We also face challenges to some of our clients who may be not willing to take the medicine, defaulters who will result into more infection, increasing the burden of HIV. We have programs to help overcome these challenges. Through the support of global funds, we have had mentor mothers assigned to these facilities since the year 2020. Mentor mothers, these are mothers who are HIV positive that have journeyed through their life, have been able to take ARVs and have their newborns not infected at the age of 2 years. What I love most about my job is seeing the mothers who come very low or the clients who come very low at the time when they get the diagnosis and having been able to overcome the stress, stigma, and they are able to share their stories. They have been able to adhere to medicine and they are able to, like the mothers are able to bring up kids who are HIV negative. That's my greatest.
Got it?
You know, we're still working on the cure and hopefully we'll find a cure for HIV someday. But right now, the way to treat it and the way to keep new people from becoming infected, the way to protect babies when they're born to someone living with HIV is for everyone to take medication. And so it's really important that we have access to that medication. We've come so far. We've made such progress for people around the world. To stop now is to give up before we've won the fight. So we've curbed the epidemic, but we need to end the epidemic. And continuing to care for these folks, continuing to spotlight how it affects them is critical to ending the HIV epidemic.
My name is Kelly Kigera. I work for Ishtar for the last 13 years. Currently, I'm playing a role of program officer. Ishtar is a community-based organization, WOE founded in 1997. So Ishtar is more of a program that is led for community with the community themselves. So what I mean by community is gay men, men who have sex with men, bisexual men, and transgender women. Ishtar has a clinic, a level 2 clinic, and also has a safe space for communities. So level 2 clinic means this is where gay men come to receive all types of services. That is either biomedical services, structural services, or behavioral services. So these types of services may include antiviral drugs, ARVs, PrEP, and condoms, lubricants, and as well receive services such as health education if they don't have any information regarding their health education.
HIV prevention and PrEP, or pre-exposure prophylaxis, is a medication that we can give to individuals who are vulnerable to HIV in certain groups. And we know that it's up to 99% effective in preventing HIV. And I've seen really people's lives changed and empowered by this tool and strategy that they never used to have. They used to have fear and stigma and shame around their sexual health and their identity. And this is really a way that they can empower themselves, their community, to remain free of HIV, and then ultimately to reduce the burden of HIV globally and locally.
Choose lead, save lives.